Welcome to MedEd Bytes, micro just-in-time education. This MedEd Byte will cover the monitor's secretion locator function, which is where we can now see obstruction location and severity. The SonarMed monitor is looking at the internal diameter of the patient's endotracheal tube. As obstructions exceed the lower tolerance of 20% of the inner diameter of the endotracheal tube being occluded, they will be displayed as a horizontal line in the endotracheal tube icon on the main screen, or as an echo in the endotracheal tube section of the waveform screen. The monitor does not report measurements of obstructions outside of the endotracheal tube. Since each baby can be different, it is helpful to determine the tolerance of secretions for each patient. Then, the clinician will have more information for when a suction intervention might be indicated. It is not unusual to find obstructions show up and then go away, as they can be fluid and move around. Therefore, it may not be necessary to suction every obstruction displayed on the monitor, as the benefit for that action may not outweigh the stress to the patient. It is always a clinical judgment as to how often to suction, and the institution's protocol for this intervention should be followed. External monitors, such as SpO2, may offer additional information to help determine best time to suction for the baby. If the patient happens to have a large secretion or two obstructions, multiple secretion locations, on the monitor, it might cause the movement readings to display invalid and not have a movement reading. This can be due to the inability of the monitor to capture good echoes within the airway due to the significance of the obstruction or obstructions. We do not want to give movement data if we can't get the most accurate reading. Suctioning the endotracheal tube and clearing the secretions may cause the monitor to resume normal monitoring. Troubleshooting tip: can secretions cause artifacts that can affect readings? The short answer is yes, occasionally they can. In this case, you can see a double echo, or a W, in the airway section of the waveform screen. The monitor is catching two, not just one, airway echo. The depth reading to the endotracheal tube is measured at the yellow vertical line. Notice how that yellow line can jump from one echo to the next one? This can cause the monitor to display a jumpy movement. Secretions can build up in the trachea or the bronchial tree beyond the tip of the endotracheal tube and cause artifact like that seen here. An effective suction per the institution's protocol should clear the airway and thus resume normal monitor function. Medtronic, engineering the extraordinary.